right, wonderful. So we'll get started today. I wanted to thank my wonderful panelists here to talk to us about COVID and long COVID and topics that are quite relevant to us right now. So the way that we've divided this up is that we wanted to make this as interactive for you as possible because I know there's a lot of questions that I'm sure that you have and a lot of commonalities, and this is a great way for all of us to talk to each other and to communicate about things that are really relevant right now. So what we're going to do is initially we're going to have each of our presenters come up and speak again, give a presentation. So they'll give their presentation each, and then I'll ask you just to hold your questions because after that's done, we'll have a 20-minute panel discussion where we can ask our panelists some questions. And then for more one-on-one time and to ask a little bit further details, we have our breakout sessions. So without further ado, I'll get started and I'll introduce each speaker and give their bio as they come up. So our first speaker is Dr. Sharum Sharif, and he is a licensed naturopathic physician and a 2003 graduate of Bastyr University. He is also a classical homeopath and is a graduate of the New England School of Homeopathy. He works full-time as a naturopathic physician at his clinic in Kent, Washington, and is an affiliate clinical faculty at Bastyr University. Dr. Sharif has written a book on homeopathy titled Visual Homeopathy and has taught homeopathy at various naturopathic schools within North America. Additionally, he has given talks on homeopathy at various statewide, regional, and national naturopathic associations, such as the AANP as well. So I'll welcome now Dr. Sharum Sharif.
So I have a lot of slides, so obviously I won't be able to get through them all. Let's see if this works okay. So there is this internet site you can go to that tells you how many people are dying of COVID every day. It's called the worldometer.info. And I just checked it out a few weeks ago when I was preparing for this talk, and the total number was 6,373,141. And then I just went to double check that figure 5 minutes later, it had increased by 100. So 100 people had died in 5 minutes. So that's like 20 people per minute. So by the time my talk is over in 15, 20 minutes, can you imagine like 60, 70 people might have died of COVID if the rate doesn't change. So we clearly have a serious problem in our hands. And the reason I'm giving this talk is that I truly believe homeopathy has shown its effectiveness throughout the ages. Over the last 200 to 300 years it's been around. We know that homeopathy works during epidemics and pandemics. There's a lot of research that I'm going to share with you here. I won't be able to go over every single one, but you have the material here in this slideshow and you can refer to it. So historically, and as well as at the present moment, we have evidence that shows that homeopathy does work for epidemics. And that's the number one reason I'm giving this talk is because of the serious nature of the disease. The second reason is that I just don't see a lot of my colleagues, naturopathic colleagues, use homeopathy for helping manage their COVID patients. A lot of them seem to shy away from taking on COVID patients, which I consider sad, because I believe we have what it takes to help our world with this condition. Even if you don't know homeopathy, you can certainly refer to homeopathy if you're convinced that homeopathy may be effective. So at least my goal for this presentation is that at least you'll be able to, you consider referring to us homeopaths. And just to be clear, if I may be a spokesperson for the homeopathic community, we are not claiming a cure for COVID or long COVID. We just want to help. We have remedies that can help me mitigate the signs and symptoms associated with COVID. I'd like to take a moment just of silence, if you don't mind, to acknowledge the loss of all the lives due to COVID and the sequelae of COVID. Just for a few moments. I wish we had more time. I also like to acknowledge the passing away of one of the greatest homeopaths on the planet, Dr. Robin Murphy, in 2022. Much of what I've learned about homeopathy is from Dr. Murphy. He was quite a giant in our field. So, the clicker, I better use the clicker here. I'm going with my own. Okay, so we all want freedom from infectious diseases, and I highly recommend that book. Homeopathy offers a solution to infectious diseases, and we're going to find out here how and why. There are lots of books written on the subject of homeopathy in epidemic diseases. These are just a couple that I just decided to share with you. So let's, okay, so for those of you who look at patients' tongues, do you think that's a wet tongue or a dry tongue? Wet, raise your hand if it's wet. Okay, what about dry? Who thinks it's dry? Okay, so that's a wet tongue. You can see the glossy nature of the tongue, and you can also see some white coating. That gentleman had severe pneumonia, and I believe it was secondary to COVID, although he didn't get tested. And his wife called me and he said, if you don't help him over the next few hours, I'm going to have to take him to the emergency room. And I said, well, maybe you should, but if you want a remedy idea, just ask me to answer one question. Do you feel like when your husband coughs, do you feel or can you detect there's fluid movement in the lung region right here behind the sternum? And the answer was yes. She could just hear it, lots of phlegm moving. So that's in homeopathy, that's an antimonium tartaricum case. So I told her to, and they happen to have a homeopathic kit at home. So I told her to give Rick antimonium tartaricum 200 C every 30 minutes. And within 2 hours, he was 50% improved. This is according to both of them. And in a few days, he completely recovered. And that's not an exception. That happens every single day in my practice, like literally multiple times a day. So honestly, that's why I'm here. I feel like we have good material to share, and I feel obligated to share the material with you. So in homeopathy, we do look at tongues just like they do in Chinese medicine. Those are some articles for you to look at. So this is a ipecac tongue, which is totally clean. That's an antimonium crudum tongue, completely covered. It's the opposite of ipecac. And then that's a total red strawberry tongue, which is typical of what you find in a belladonna case. So this right here, can you play that? Okay, that was me coughing. So that's like a month ago. Was that a dry cough or a wet cough? Dry. That was extremely dry. I felt like I was suffocating. It felt like I was breathing through a towel. Extremely difficult to get air in. And of course, I knew that I needed spongia. So I took the remedy spongia. I took the remedy spongia. And I felt better, like literally the moment that little pills touched my tongue. And for those of you who don't know homeopathy and don't believe in it, you might find that difficult to believe. But for those of you who are believers, you don't need me to convince you. That's how fast it works. The pills work fast. So I literally could breathe like within seconds, just completely fine. And that's just one example. Okay, so topics for today's talk. Basically, we have one of the world's greatest threats on our hands, which is infectious diseases, as you know, and they're on the rise. And I'd like to share some effectiveness research that shows that homeopathy is effective in general, but also in particular regarding epidemics and pandemics. And then I'm also going to discuss the management of COVID-19 in particular, as well as long COVID, or what people call post-COVID, as well as post-COVID vaccine sequelae. And then some basics of prescribing homeopathic remedies during epidemics and pandemics, and at the end, a few case studies. So I gave a talk on homeopathic prevention and treatment of epidemics and pandemics exactly 3 years ago in August of 2019. And that was a few months prior to the COVID-19 pandemic. I'm not a psychic, but I think because homeopathy is just such a wonderful tool for dealing with pandemics and epidemics, I believe most homeopaths they just have a higher radar when it comes to epidemics and pandemics. So most of us probably knew that we were going to be, experiencing a pandemic, although it wasn't news to most of us. I mean, I think even the conventional community was expecting it, but homeopaths were just always on it when it comes to epidemics. So, so that's why I was preparing myself and my colleagues at the time. Those were the topics I discussed in my previous presentation. Again, we have a major challenge on our hands, a public health threat. You heard that yesterday WHO announced monkeypox as an international public health threat. And since 2009, I believe they have made 7 such announcements. So that's 7 pandemics since 2009. So obviously epidemics are on the rise, and they threaten us. And I don't know if you've noticed, but over the last few months, we're starting to get like a whole slew of viral conditions that we hadn't probably seen over the pandemic. And this article the title of this article is catchy. The viruses that were on hiatus during the COVID pandemic are back, and they're behaving in unexpected ways. That's what I'm finding in my practice. I feel like the floodgates have opened. I literally work like 10, 12-hour days, 6 days a week. I'm just slammed. So I feel like those of us who are doing, who are successful treating viral acute conditions like myself, we're just overwhelmed. So if you are handling these acute patients, take good care of yourselves because we need to be healthy to take care of the society. So a month ago, I was just, I get these newsletters from different homeopathic institutions, and I just got this article on monkeypox. I haven't read the article, but I just thought I'd put the link in there. So that's a month ago, before WHO made the announcement yesterday. Already homeopaths were on it, and they were like, okay, what are the remedies for monkeypox? And so I just thought I'd share that link with you. The main advantage of homeopathy over other systems of medicine is how adaptable it is. We can adapt quickly. We don't require tests. So when people call me, they're like, I have the following symptoms. Do I need to get tested before you can help me? I'm like, absolutely not. It really doesn't matter to me if a person tests positive for COVID or negative, or whether they have the flu or not. We go by symptoms. We go by totality of symptoms, 1. 2, by the overall state the patient is in. So the patient's state and totality of symptoms is what we go by. So and we can adapt. So it could be subvariant, Omicron, what is it, BA2 or BA4 or 5. Our treatment doesn't really matter on the particular subvariant, or it could be influenza. Like a few weeks ago, I had a patient, I honestly wasn't sure if it was influenza or COVID, but I thought, most likely it's actually influenza, which I hadn't seen influenza for 2.5 years. But the treatment would be the same anyway. So I just gave them Eupatorium, Porphyriatum, and that completely took care of the case. So we are adaptable, we can adapt. And we need that right now, because there's like viruses are fluctuating, there are new viruses coming on. We need a tool that can be adaptable and effective and inexpensive. Okay, so there are overlapping viruses. What if someone came in that had the flu and COVID? What would you do? I mean, it would be difficult to handle it if you don't have homeopathy in your bag of tools. I think it would be challenging. Again, for us, it doesn't matter. We just ask, what are you coming in with? What are the symptoms? Can I get a 5-minute warning before my talk time is up? Okay. So there are a lot of medical doctors, believe it or not, who are contributing to research in the field of homeopathy and COVID. There's one local doctor, Dr. Jennifer Jacobs from University of Washington. She's written articles, given talks, webinars, and is presently doing research on homeopathic management of long COVID. So it's really encouraging to see medical doctors, getting into this field. Dr. Hahnemann started the use of homeopathy for prevention of scarlet fever. He's the first person who used homeopathy during a pandemic, and his suggestion was successful enough. The government of Prussia, the Prussian government, had actually ordered in 1833 that they used that remedy for prevention of this illness. So there are lots of articles from different parts of the world: United Kingdom, India, Austria, Brazil, Cuba, India, Hong Kong, Israel, Italy, that actually show that they are doing work in this field. As far as historical evidence that homeopathy is effective for epidemics and pandemics, you can refer to some of these sites that I'm sharing with you. There are over 6,000 PubMed homeopathic studies that demonstrate homeopathy is effective for treatment of all kinds of these illnesses and diseases. You can refer to those if you're interested. Okay, like this is an article on severe sepsis from Austria, double-blind placebo-controlled study that shows that homeopathy is effective. This is one on COPD from Spain. This is one on fibromyalgia published in the Journal of Rheumatology. This is a randomized controlled triple-blind study on chronic fatigue syndrome. And there's conversation about how homeopathy is basically nanomedicine. You can look at that if you're interested. This one is a randomized placebo-controlled trial that shows that homeopathy actually does have an effect. I think they're kind of minimizing it, but still it's better than nothing. The governments of Brazil, Cuba, and India, they have and continue to use homeopathy for epidemics and pandemics. Notice they're all third world countries. You can just come up with your own imagination as to why those countries would be interested. I'm just going to I have to go fast here. So what about evidence and research on homeopathic management of COVID in particular, not past epidemics? There are a lot of studies here. You can look at those. Look at every single one of these studies is legit from hospitals and clinics throughout the world. A lot of them are conventional. Like this one is a study on effectiveness of the remedy Manzanella in COVID-19 alopecia. This is from India. It's completely scientific, double-blind, placebo, case studies. This one is also from a professor of pathology from India, using homeopathy for treating COVID cases. This particular study is very helpful because it's basically showing how you can use homeopathy with conventional medicine in a hospital setting. It's a case series, and they have come up with these algorithms where they actually handed these algorithms out to conventional doctors, and they said, if a person has that symptom, you give it remedy X. If it's the other symptom, you give it the remedy Y. It's a very helpful algorithm. I don't recommend treating COVID if you don't have experience in homeopathy, but it's obviously something that can be done, and it's being done in Austria, in this particular hospital. Dr. Sain, God bless his soul here. Dr. Sain has been extremely helpful to all of us homeopaths. He has lots of material. He's been keeping us all up to date on the subject of homeopathic management of COVID and long COVID. You can find all of his talks there. Dr. Paul Herskew as well, beautiful epidemic updates. And we have various doctors just writing wonderful articles on the subject. You can refer to all that. They're coming up with new remedies or suggesting new remedies for COVID that I hadn't personally thought about, like the remedy Senega. You can look at that. I think my time is just about up. Here's one study that is well worth talking about. It's a randomized single-blind placebo-controlled study from India that actually shows in regard to every one of those symptoms, combining homeopathy with conventional treatments works better than just conventional treatment alone. Is my time up? Good. Okay. So I'm just going to flip through these. There are my presentation is obviously long. I realize that, but I wanted you guys to have all the material you need if you're interested in pursuing this. So like the Dr. Wadhwani is a homeopathic genius from India. He's got a wealth of information on homeopathic management of COVID and long COVID. You can refer to his talks here. He's got online classes. Dr. Bhatia, same thing. These guys are giants in the field. India is truly a pioneer in the field. Lots of research from India. Hospital setting, they do research in the hospital setting. It's just beautiful. Homeopathy in India, a lot of them are able to help COVID patients alongside medical doctors in hospitals. I think that's just beautiful. This is a study from Brazil. This is a study from Hong Kong, Italy, India. And then we have databases like American Institute of Homeopathy, as well as Clinical. They have been gathering information from practitioners like myself to see what remedies are showing up. And so those are two different large international databases that we have been contributing to. There are lots of case studies published in the American Institute of Homeopathy journal. If you can look it up online. Like this one in particular is written by the president of the American Institute of Homeopathy, and he's comparing to the top remedies for homeopathic prevention of COVID. And then there's the subject of prophylaxis. Lots of studies here done on prophylaxis from different parts of the world. And then what are the top remedies for COVID? Depends who you talk to, but depending upon the locality, the country, the continents, the top remedies seem to vary. But I can tell you in the part of the world where I'm practicing, I'm going to get to what the top remedies are, but let me just cover this one in particular. One of the coolest remedies I've come across is carbonium oxygenacetum. That's homeopathic carbon monoxide. Imagine if you've been asphyxiated with carbon monoxide, the sensation apparently is very similar to what happens to COVID patients. So Dr. Andre Sain has an article on the use of this remedy in COVID-19, and he has found it highly effective. So that's something to pay attention to. The posology is there. These are just different, all kinds of suggestions by homeopaths across the planet. Now, as far as myself, what are my top remedies? Those are my top remedies. Of all those, I can tell you these are my most, I use them every day. Bryonia is by far the most common remedy. Gelsemium is second, antimonium tart and gelsemium, they keep flopping depending upon the subvariant. And then the other remedies are below. So if you just know Bryonia, gelsemium, antimonium tart, for God's sake, just those three remedies can help a lot of people. And by far, Bryonia is the top one, at least in my practice. And I believe a lot of homeopaths would agree. So there is that beautiful poisonous herb. It's not edible, but the remedy is unbelievable. So one thing is worth noting is that the keynotes of Bryonia, the top keynotes would be it's dry, it's left-sided, and it's painful, worse with motion. So if one thing that's happening a lot is that people catch COVID, they get over it supposedly. And these long COVID patients, they're left with dry conditions somewhere in their body, inside or out, as well as left-sided signs and symptoms. So like left-sided paralysis, like people come in and they can't walk, they can't use their left knee. And I ask them, and oftentimes we find that it's correlated with COVID. And the remedy Bryonia can reverse those cases, at least help them profoundly. You can look at the reviews on my website to see some really cool patient reviews that have gained control of their left lower extremity after the use of this remedy. So you can read the rest of these slides. I'd like to finish by saying that, honest truth, I probably had one patient with COVID so far that I couldn't help, and I had to refer to the emergency room. And I've treated over 500, I don't know, I've lost count, like 600, 700, 800 COVID patients. None of them were urgent cases, but they were, I'd say, mild to moderate and sometimes severe. So that's not too bad. Just one patient ended up in the emergency room that I couldn't help. My own mother almost died of COVID a few months ago, and I stabilized her, but at the end, we had to take her to the hospital because she had pulmonary edema, and they saved her life. So I think I really, truly believe conventional medicine and homeopathy, naturopathy, we have to all come together to help humanity at this time. Thank you so much for your time.
Thank you, Dr. Sharif. That was actually really interesting. I'm glad I got those takeaways about which ones to focus on as well.
Good morning, and thank you very much for your presentation. My question was, well, I have two patients who post-COVID are suffering with POTS-like symptoms and dizziness. And my question is, have you seen patients like that? What was your treatment? What were your options? I've sent them to cardiologists, but no success. I'm still looking, I reside in San Diego, so I'm still looking for a POTS specialist cardiologist that could at least get a diagnosis. But these are two patients that are severely suffering with POTS, and I would like to know if there is any treatment options. Thank you.
Is this working? All right. I'd love to take that on. I have had a few patients with dizziness, well, actually a number of patients with the chief complaint of dizziness post-COVID, but one in particular was a teenager who was diagnosed with POTS. I would say what I've seen in common among these patients are the keynotes of the homeopathic remedy gelsemium. which one of the top keynotes is just poor balance. They may not have vertigo, but they just have poor balance. And I have the slide in my presentation on the top keynotes, which would be extreme fatigue, weakness, poor balance, and a lot of times oftentimes they have a suboccipital headache, at least tension, muscle tension in the back, and just overall generalized aches and pains throughout their body. So this teenager with POTS, he had nausea nonstop every single day for months, like almost, I think, over a year or close to a year. His mother wrote a review that I have put on my website under the COVID page for reviews. He had nausea every day, vomiting every single morning, but severe nausea all day long. He basically had to stop going to school for an entire year. It literally like ruined his life. He basically was completely dysfunctional. So the remedy Gelsemium 30C in his particular case, 2-3 times a day, day after day, I think he started improving the day he took it, but I think within a couple of weeks, he was significantly better. If I'm not mistaken, just going by memory, within a month, he has so far been 75% better. And he just keeps getting better. And his constitutional remedy, I don't know what it is yet, but it doesn't matter. I mean, he's just in this acute state, which we call Gelsemium. And he's extremely grateful. And of course, his mother, when he came and saw me, he was like, oh yeah, those little sugar pills, like that's going to reverse my child's POTS. And I'm like, I really think it probably will. And it is. So it's like day by day. Yeah, and the child is just ecstatic. He went to the movies over the weekend last weekend, and he's getting his life back. Yeah. And we've had lots of other patients with dizziness, poor balance, extreme fatigue, generalized aches and pains. So this is all Gelsemium, which is what I'd say is my second top post-COVID remedy. Bryonia, it's been my top COVID as well as post-COVID remedy, but Gelsemium is the second one. And I don't want to generalize, that may be different for other homeopaths throughout the world. I mean, I know it is different, but that's what I'm finding. So yeah, dizziness, it comes up a lot. Poor balance, it may not be dizziness, their balance is off. Does that answer your question?
We have one question regarding homeopathy regarding the charts. So is there a more complete chart for homeopathy that you could refer to? I guess regarding the treatment plan or the treatment ideas. So it's coming from the online. So perhaps if you want to emphasize that a bit more, so there's a more complete chart of homeopathy that you are recommending. So I wonder if they want, maybe something more concise, or maybe.
I'm not totally clear what the question is, but I can tell you, if you look at my long PowerPoint presentation, there are some slides that have summarized some of the top ideas. Like there's one that says my top remedies for COVID, management of COVID, right? The top remedies for management of post-COVID. And then I do have actually a slide on how to homeopathically chart patients. I don't know if that helps. Hopefully that'll help.
Is it on now? Okay. I have a question about Paxlovid. If any of you all are using it, any concern about using it? And the follow-up question is, there's been some data coming out about Epstein-Barr reactivation in long COVID. So I'd love to hear anything that you're doing to address that.
May I just add one thing about the reactivation of Epstein-Barr? So I think one subject that keeps coming up, I think in medical circles, I've noticed is the fact that when you get patients these days with acute conditions, the subject of testing comes up, of course, for COVID, the flu, whether they have EBV, reactivation, et cetera. And even if the tests were available, even if you could immediately test patients for all the above viruses, I think the tests are not always reliable. That's one, I think, major issue we have. The second thing I wanted to say is that at least from my homeopathic perspective, I just go by what's presenting to me at the time. So if a patient comes in and they've tested with COVID and their blood tests show reactivation of Epstein-Barr, for me, I know it sounds unscientific, but it's immaterial what all viruses are at work, as long as I see how their body's responding. So if their body's responding in a gelsemium way, they get gelsemium and they respond positively to that remedy or whatever the remedy might be. And we're not treating these diseases, we're just treating states of being. So if the patient is in a gelsemium state, they get gelsemium. If they're in a bryonia state, they get bryonia. So antimonium tart, etc. So there's a major advantage in homeopathic treatment of all these viral infections that could be overlapping, which is I have several slides on that I didn't get to cover, but I think that's a huge problem. And yes, I have had lots of patients come in with reactivation of EBV and they're freaking out. And they're like, on top of that, I have COVID, Dr. Sharif. What should we do? And most of my patients are taking supplements, nutritional supplements, and they're still not feeling well. Of course, I know they would probably be much worse off without the supplements, but they're still in trouble. And they seem to respond very well. I mean, just surprisingly well, actually, to just these over-the-counter homeopathic remedies. So